Thyroid surgery. Introduction.
The thyroid hormone allows the cells of the body to use energy and function efficiently.
Select true or false.
Correct. The thyroid hormone tells the cells of the body how to use energy by controlling metabolism.
The pituitary gland is within the thyroid gland.
Select true or false.
Correct. The parathyroid glands are within the thyroid gland, not the pituitary gland. The pituitary gland is located in the base of the skull, just under the brain.
With hypothyroidism, the thyroid gland does not produce enough hormones.
Select true or false.
Correct. With hyperthyroidism, metabolism decreases.
Select true or false.
Correct. With hyperthyroidism, the metabolism of the body increases.
Infection and anesthesia-related complications are common during or after this operation.
Select true or false.
Correct. Anesthesia-related complications and infections during or after this operation are rare, but they could still happen.
The parathyroid glands may get injured during thyroid surgery.
Select true or false.
Correct. The parathyroid glands may get injured, which may lead to low levels of calcium in the blood or hypoparathyroidism. This can easily be treated with calcium supplements. Low calcium in the body may cause jitteriness and involuntary muscle twitching.
Select true or false.
Correct. Signs of a problem with the level of calcium in the body include cramps or tingling in the hands, lips, or feet. You should call your doctor if you notice any of these signs.
Thank you for using Explain.